They did quintuple bypass, and I'm like, oh, like I hadn't even heard of that.
5 different arteries all getting clogged. How do surgeons pull off a quintuple bypass? Good morning. It is Thursday, February 16th. I'm Jessica Lovell. Welcome to the Morning Medical Update. The man you are about to meet went from the nightclub stage to the operating table and then back to the nightclub stage. Alexis Del Cid explains the sudden chest pains the 54-year-old could not ignore.
How long have you been drumming?
Oh God, since I was 5 or 6, so forever.
When Sam Platt performs, feeling his beats, dancing with his own heartbeat, can't remember a time he wasn't drumming. Drumming is a huge part of what makes Sam, Sam.
Like, it's the most fun instrument to play. You just gotta carry more stuff, you know?
And before he got sick, this is where you could find him on stage, sometimes 6 nights a week, jamming out at the Green Lady in Kansas City. Even when he's not on stage, he's still drumming, whether it's rehearsing, teaching, or even conducting music therapy sessions.
I got to go to a hospital in Springfield one time where they gave me hand drums and they were doing experiments, and they found that hand drumming, like the patient actually touching the drum and you helping them do that, had like a way higher success rate than someone coming in and just playing guitar and singing you a song.
Sam never dreamed years later he would be the heart patient in the fight for his life.
Sam Platt on drums.
Although looking back, he realizes he wasn't running at a sustainable pace.
So I was playing a lot, and I just go, go, go. And I think I was eating whatever I wanted, and I would stop and get fast food on the way to the gig. And I was taking a blood pressure pill, but I wasn't really checking my blood pressure very much. I knew I needed to walk more, I knew I needed to exercise more, and I wasn't doing it.
On August 31st, it came to a head. Sam had just returned home from one of his typical jam-packed days, capped off with band practice at 10 p.m., and he had a terrible stomach ache.
I just felt like I had the worst heartburn ever.
At 4 a.m., he finally woke up his wife and had her take him to the hospital in Lawrence, where doctors didn't like what they saw. Next thing he knew, he was in an ambulance headed to the University of Kansas Health System.
Thank you. And they did that, and we're like, okay, wait, we got to pull in the big guns.
One of those big guns?
Hi.
Hey,
what's
there
happening?
He is. How's it going?
Good, man.
Thoracic surgeon Dr. Tyler Zorn.
You look good.
Yeah.
Soon, Sam was scheduled for open heart bypass surgery, and not just any bypass.
They did quintuple bypass, and I'm like, oh, like I hadn't even heard of that. I thought quadruple was like the most you could do.
Quintuple bypass. The last thing Sam remembers as he drifted off was Dr. Zorn asking him a question about his arms.
I think the last thing he said was like, is it okay if I take arteries and veins from wherever because I need to harvest?
Sam remembers saying, do whatever you need to do, and it was lights out.
Sam, we are so happy to have you with us today. Good morning.
Good morning.
Good to see you. Love that story and can't wait to talk to you more. We also have one of those big guns. Yes, Dr. Tyler Zorn is right here with us. How are you today?
Good. Thanks for having me.
Thanks for being with us. How long has it been since you two have seen each other? It's always fun to reunite.
Probably about, we were just talking, probably about November since we saw each other in the clinic last. It's been a while.
How's he look? I know the beard's probably a little longer, but how's he look?
I don't know. The beard looks about the same to me. Actually, interesting you say that. Before we went off to surgery, he was like, can we keep the beard? It's
priorities, Doc.
Yes.
It's priorities,
Yeah.
right? That's his look. He's a true rock star.
Absolutely.
So,
Looks
Sam, take us back to those first symptoms because you said it felt like heartburn.
Yeah, I had a full day and got home, and felt like I had heartburn sort of high up in my stomach, and I took Tums and antacid, and nothing helped, and went to bed and thought, maybe I could go to sleep, and I couldn't sleep at all. So finally I got up, put my clothes on, and woke up my wife at 2 a.m. and said, we gotta go to the hospital. And she was like, why are you waking me up? And then she saw that I was dressed, and she thought, oh, this is serious.
Yeah, she knew it was go time, and that was really smart to do that. I have to ask you, Dr. Zorn, though, is having that heartburn feeling pretty typical? I know I've felt that before and taken myself to the ER thinking, oh my gosh, something's going on in there. Can that present that way?
It can, and it sometimes is a confusing picture, which is kind of what happened with Sam. It's we were kind of led down this rabbit trail of, is this an abdominal problem more so than is this a heart problem?
But he knew something wasn't right, so that's what was so great that he came in. Sam, what did doctors in Lawrence say was wrong with you when you made it to the hospital?
Well, I got there, and it took us a little while to figure out what was going on. They gave me 3 hits of nitro, and that didn't do anything. So we did an MRI and realized that I had a little cut in my celiac artery. So that's the point that they were like, okay, well, our heart surgeon has retired, so we're putting you on an ambulance, and you're going to HayUMed.
So when they told you you had to come to the University of Kansas Health System for a higher level of care, what else were they telling you about what might be happening once you arrive?
Well, we thought it might be something to do with the heart, but mostly all I knew at that point was the celiac artery. There was something going on with that, and but by the time I got there, I was so drugged up, I was just having a good time anyway.
Okay, that's fair enough. I get you. So, Dr. Zorn, then you meet Sam. Did you know immediately what was wrong? What kind of testing did you have to do on him? What was he diagnosed with?
So Sam came to our medical ICU. He didn't come to me first. And like you said, he came with this diagnosis of a celiac artery dissection, which is a tear in one of the major blood vessels that goes to some of the stomach organs like the liver, pancreas, spleen, stomach. And so that kind of, that was one problem that he came with in his principal diagnosis that the medical ICU was treating. But they did a great job in not just treating that one problem, but making sure all organ systems were in check. And so they checked and trended labs such as a troponin, which showed that level continued to go up, which can go up when you have heart and muscle injury due to a relative lack of blood flow down the coronary arteries to the heart.
So we have some video.
Yes.
The cath lab, and this is Sam. I want to take a look at that, and then I want to have you tell us what we're seeing. Could you tell that all of the arteries were blocked?
Well, sure. So after the troponin levels were rising at a rapid pace, that's when the cardiology team actually got involved. And so Dr. Spady is the individual who performed this left heart catheterization, which is where you go through one of the arteries in the wrist. You can go through the groin or the wrist, and you can inject dye into the major coronary blood vessels, the right and left circulation. And when you look at these vessels, you can see blood filling those arteries, the right and left arteries, and you can see where narrowing occurs and what vessels are critically blocked. And at this point, you have to make a decision about what the next steps in therapy are. Because
so those don't look blocked from my eye. You're saying that the fact that it's thick and then it gets thinner, that's showing the blockage.
Yeah, it shows you the degree of narrowing. And if you probably slow them down and magnify it a little bit, you could see some of those blockages.
Okay, so you knew right away that we're looking at a quintuple bypass surgery, correct?
Well, Dr. Spady knew right away that the options, were to intervene from a stent perspective, or he needed to engage the cardiac surgery team. But he also realized that when you have this many blockages, multiple stents are not really a great option. So cardiac surgery is really the best route to go, and that's where we get involved. And yeah, we examine the cath, the left heart cath, and we can kind of tell relatively how many bypasses one needs.
Okay, but you find out you need 5, not 1, not 2, 3, or 4, but 5. And when you look at this, is it like, oh wow, we got to come up with a plan and quickly? What's going on as far as the planning and how soon you can get him?
Sam was relatively stable when he arrived at the hospital, and the most important thing was figuring out, well, is the celiac artery dissection a problem? And over the course of days with treatment and anticoagulation, that seemed to settle out. And then we like to give patients that have had he had a heart attack, you know, with the rise in troponin that he had. We like to give patients a little bit of time to settle out before we take them to the operating room, given his relative lack of stability.
So what is a bypass? What are you doing in there?
Yeah, so a bypass surgery, you know, it's been around for a number of years, about 50 years now, and essentially what you're doing is routing blood flow around the blockages, taking native blood vessels, either the vein from the leg or the artery from the chest wall, to reroute that blood flow.
So Sam, before you had to go to the hospital, were you thinking much of your heart health?
No, not at all. I had just like 3 months before that started on a high blood pressure pill, but that was it.
Did you ever feel like something was going on in your heart? I think people listening want to know, what should I be feeling in my body? Did you feel like your heart was changing? I know you were on blood pressure medication, correct?
Right. But I was just on the minimum. But no, I didn't notice it at all. I think I had just gotten used to like my living at that higher BPM, you know, just I was used to my blood pressure being that fast. So after the surgery, when I got blood pressure medication, I felt really slow and kind of tired because I just wasn't used to what the way your heart is supposed to be working.
Right, and that's a big problem when people just get used to living the way they live, right?
Yep.
So it's hard to tell those some of those symptoms. But how rare is a quintuple bypass?
I don't do them that frequently. You know, it's really not the number of bypasses one gets during their surgery. The main point is that you revascularize all the areas that are blocked that you can possibly do. And so in Sam's case, it just happened to be 5. And I think it was important for him, given the fact that he's on the younger side, to revascularize as many areas of his heart that was possible.
So you said you needed to harvest, we heard that in the story before, harvest a vein for each bypass. What part of the body are you harvesting from? How does that work?
So it's not necessarily all veins.
Okay.
Our team usually works in tandem with PAs, physician assistants in the operating room, and so we harvest an artery from the chest wall. The left internal mammary artery is what the surgeon normally works on. And in tandem, our physician assistants work to harvest the vein from the leg. It's the saphenous vein. It's a superficial vein that you can do without. We are finding that in patients, when we use more arterial grafts, like the artery from the chest wall, we can use the radial artery from the arm. We're finding that these grafts are more durable, that can add a mortality benefit, meaning people live longer. That this is a good route to go.
So it's harvesting like its own little mini surgery within the bigger picture, and are you doing that all in tandem?
I consider that kind of step 1 of coronary artery bypass surgery, because you really can't do the main part of the surgery until you have good quality conduit to construct your bypass grafts with.
So we've got more questions coming up for both Dr. Zorn and Sam, so make sure you get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to those right there on your screen. But let's get a quick check on our COVID count with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Good morning. How are you?
Hi, good.
Hi.
Yeah, right now we're holding steady in those mid-20s of active infections. 51 total, 26 active infections. Unfortunately, we've seen the number of ICU patients increase slightly, with 7 in the ICU, and unfortunately a large proportion of those 4 are on the ventilator. So unfortunately that we do have some severe disease right now here in the hospital with COVID-19.
All right, Doc Hawk, an interesting headline for you. Want to hear what you have to say. So as reported by the journal Nature, the World Health Organization, they've abandoned, basically given up their search for what caused COVID-19 in the first place. WHO researchers visited Wuhan, China 2 years ago. Their leading theory back then was that it jumped from bats to humans, but now there's not much going on, and there's not much of an official follow-up on that theory. So Doc Hawk, why are they giving up the search?
Yeah, I mean, I think mostly it's logistical and political issues, especially dealing with the amount of information ability to be gained from China and what they will release. I think that is part of it. A lot of this really does tend to be political and logistical. We do, our best theory and the best data to support that, the best evidence to support that through many publications is that yes, it was probably the virus probably went from bats to an intermediary animal and then to humans. More than likely, it did originate from that Wuhan market. There were 2 very good published articles in the end of last year that corroborated a lot of that. So again, the best evidence we continue to have is that it was a spillover event, and probably actually multiple spillover events around that Wuhan market area. There really is not much other data to suggest any other either accidental nor purposeful release from that Wuhan Institute of Virology.
But knowing exactly where the virus came from, does that really mean much for all of us, the general public, or is it really just something infectious disease docs like you really care about?
Yeah, I think that's an important point. I don't think it's exactly where it came from, and we may not, because there may have been recombination events of a couple different viruses creating this virus that are frequently found or can be found in the bat population. I think we need that umbrella approach, though, understanding that there are many, many other viruses that can spill over, especially from bats themselves. And so I think we really need to get those good scientific research and public health resources and finances up to date so that we can be having that active surveillance, understanding what is likely to happen or what are other possible spillover events that might happen. So I don't think the specific area, but we know that other coronaviruses very similar to SARS-CoV-2 have been found in different areas around the world, and especially around China as well. But knowing the specific, I don't think is as important as continuing the research and the surveillance to help prevent further events in the future.
All right, Doc Hawk, let's get back to our questions. Dr. Zoran, how long was the surgery? You mentioned the teamwork, but tell us what it looks like when something like this is going on in the OR.
I think Sam's surgery is probably around 3.5 to 4 hours. And the teamwork is really something else in a cardiac surgery operating room. It's really, I can even remember the first time I just observed a cardiac surgery case, the orchestration that occurs to make one of those operations work was incredible. And so, for my team, it's a physician assistant or a cardiac surgery fellow that works as my assistant. There's a surgical tech that's responsible for getting all the instruments and suture that we need to perform the operation. There's a circulating nurse that is responsible for managing all the OR needs. There's an anesthesia team that's comprised of a specially trained cardiac anesthesiologist who also has their own CRNA with them, or a resident and an anesthesia tech. And the heart surgery itself is not really possible without the cardiopulmonary bypass machine, and that requires a perfusionist to run that. And so it really is it's a team effort. That's why I went into the field, and it really takes the team being in sync to deliver really good care, especially in difficult situations.
I'm envisioning this like well-orchestrated dance, choreographed. Everybody knows their role and knows where to be at the right time.
Yes.
Something we were talking about before we went on this morning was actually getting the heart. No way to show the gratitude of a heart donor and their family. But when that heart is available to be transplanted, tell us about how that goes down, because you were saying sometimes you actually go get the heart and bring it.
Yeah, there's it's just kind of switching gears, talking a little bit about heart transplantation. So You know, when you know, you have recipients that need a heart, you have donors that aren't necessarily in that hospital. So it requires a donor team to go out and procure a heart and bring the heart back to the hospital where a recipient's at for the implantation. So.
Yeah, but I think it's interesting. I thought you were just standing in the OR and the heart just kind of shows up.
No.
You actually go.
There's no FedEx for the heart
Nope,
or drone
you go
or
get it.
anything
You've been on a plane to go get it. You said you've been in the car. Somebody drives you to go get it, and you make sure that that heart is taken care of all the way till it gets to a patient like Sam. That's really kind of amazing. That was a big moment for me this morning. Thank you for sharing that. I thought somebody else was doing all that for you. So, so Dr. Zorn, is it true that a bypass doesn't last forever? Will Sam have to go back in and have more work done on his heart?
Well, I hope not. I would hope that the arteries that we bypassed in Sam's heart last for a long time. So the left internal mammary artery and the radial artery should be very durable, long-lasting grafts. The vein grafts, not so much, and that's right. So at about 10 years, probably about 60% of the vein grafts that we place on patients are still patent, still have blood flow, and that's looking at nationwide data. So, but there are things that you can do, proper vein harvesting, good handling of the vein, and good surgical technique that I think can reliably raise that number from 60% to higher. And then, as those vein grafts go down or stop working, it doesn't necessarily mean that he needs another intervention. It certainly doesn't necessarily mean he needs surgery. And so it just at that point will depend on how he's doing from a clinical standpoint, how his heart is functioning, whether or not he will need any kind of intervention in the future. And it's my hope that for Sam that he never ends up in the cardiac surgery OR as a patient.
Yeah, we want to keep him on the stage, behind his drum set at all times. So, but bypass has been around 50 years. I mean, it must have come a long way in 5 decades.
I think it's still a pretty standard operation, but like we said, at first all veins were being used, then we learned about the benefit, durable life-saving benefit of the left internal mammary artery, and as we continue to kind of evolve our thinking about how we do bypass surgery and results, we kind of change what conduit we use to help patients more.
You think it's standard and ordinary, but we don't think what you do is ordinary. So you hang out with really brilliant people like yourself all the time. So we love to hear from you. So I have to ask you, Sam, what has recovery been like for you? Are you back to 100% yet?
I feel like I am. It's been great. I mean, I started physical therapy a couple of weeks after getting out of the hospital, and everybody there was just fantastic and got me on a really good regimen of walking and exercising. And then once I finished that, I joined our community center in Eudora, and so they have all the gym equipment and everything I need there, and I'm walking about 5 days a week, and shoot baskets in the gym there, and so everything's been going really well.
Nice. When's your next gig? Are you playing soon? You playing tonight?
Of course. Yeah, tonight. Ex-Passionates are playing at Record Bar tonight. So.
Nice. Where else do you play? When else do you play so people can come find you?
Saturday night, I'm downstairs with my trio at the Orion Room, which is downstairs at Green Lady Lounge. And then that same trio has some more gigs coming up next door at the Black Dolphin. So that's jazz, mostly jazz. But tonight is like a mellow rock band.
Nice. Well, we're so happy you're back. I'm sure you are too. I'm sure your bandmates are so happy to have you. Is it nice to see him back doing what he loves?
It's unbelievable. It's the reason we do what we do.
Yeah.
I mean that sincerely.
Sincerely.
I can't.
All right, let's see if we have any reporter. Yeah, Sam, please go ahead.
Oh man, if you guys can tell all the nurses and everyone that helped me at KU Med, I just want to thank them so much, and Dr. Zorn and his team. I mean, I never felt like I was in any danger. I was you're asking me how I felt. Everything seemed fine because they are so organized and everything ran so smoothly that I never felt like I was going to not be back at 100%. So
you got to love that.
Yes.
All right, let's see if we have reporters on the line today. Let's get to our viewer questions. And Jean has a question, and I know we talked about this earlier, but I want to go back to it because I think it's really important. I told you I was having heartburn, and I know like for women, sometimes heart attacks can present differently. And I remember going to the ER and going, should I go to the ER? I'm going to have a big bill I'm going to have to pay if it's just heartburn, but what if it's a heart attack?
Yep.
So I don't want people to not go, but how do you distinguish between the heartburn and the heart attack?
Yeah, I mean, I think as Sam appropriately did, he treated himself for indigestion, and yet it didn't get better. And so it's out of the ordinary pain that doesn't get better to your standard regimen that you use when you have those standard. And then at that point, you have to decide, do I need to seek professional help? And that's either in a clinic or that's in an emergency department. But I think out of the ordinary symptoms that don't go away with, standard therapy, you should get checked out.
Don't wait too long. Allie wants to know, is there an age range that you can age out of being able to have bypass surgery?
That's a good question. There's a lot that goes into deciding whether somebody is fit enough for cardiac surgery. Most of the time it's, the concurrent illnesses they bring to the table, how physically fit they are. And certainly patients that are younger, such as Sam, in their 50s, have a lot more reserve in order, to undergo a big operation like it is. But I think it is appropriate to operate on somebody into their 80s if they're in very good health and if it's something that the patient really wants. But I think as your patients get older and the question comes up, you have to really ask yourself, what am I doing? Am I really helping this person? Proper informed consent about what the surgery entails, what the risks are, and then what it looks like on the other side. Am I getting them back to what they love doing? Am I getting them back to a quality of life that they would deem acceptable? It's not appropriate enough just to have an alive patient. We can get almost anybody through an operation, but getting them to the other side to a successful outcome, such as getting back to what you love doing, is what we should all be aiming for.
Like Sam.
Yeah,
like
exactly.
Sam. Janet wants to know, Sam, did you change your diet at all?
Absolutely. In the hospital, everything was low salt, low sugar. So I'm still doing that diet. I haven't had any pop or fast food, maybe once or twice since I got out of the hospital. But mainly just really looking at labels and paying attention. Simple things like when I was in PT, they said try to every meal have a vegetable on your plate. So like that's helped me a lot. That's what I try to do every day, is have some kind of vegetable on my plate, and just really paying attention, just being aware of what you're eating and not eating fast food and junk food it doesn't really fill you up for very long, and it's really hard on your body. So I feel a lot better now that I'm drinking a lot of water, walking a lot, and making most of our meals at home.
Yeah, well, shooting those hoops and eating those veggies, that's going to be really what puts you in control, right? There's so much you can control about your health, and those are the things you can't control, right, Dr. Zorn? So keeping you healthy. I want to get final thoughts from our guests. And Sam, I'm going to go ahead and start with you. Sam, can you? Yeah, go ahead.
Well, I'm just so grateful for everybody at KU Med and my family that helped me do this. I really had no idea that I had any heart problems, so I want to tell everybody to go get your heart checked. Go buy a cheap blood pressure wrist cuff that you can get on Amazon or whatever for $30. It might save your life, and that just don't underestimate You know, when your doctor tells you to go walk, go walk. A little bit of exercise and eating healthier really, I think, goes a long way. And so like Dr. Zorn told me in the hospital, basically I got a new lease on life, so I want to try to make the best of it.
Such fantastic advice right there. Thank you so much, Sam. We appreciate you sharing your story with us today. Dr. Zorn, final thoughts.
Well, I want to say thank you to Sam. We don't always get the pleasure of seeing our patients, you know, this far out from surgery and doing as well as they are, and it means the world to me to see that you're back doing what you love doing. We don't, you know, sometimes our outcomes are tougher, and we've talked a lot about the team piece here, and I think the teamwork around teamwork in the hospital is something that really deserves a lot of credit in Sam's case every day, because it's really not possible without a good medical team that establishes a diagnosis, that gets the right team involved, like our interventional cardiologist. The OR staff is phenomenal here. The PAs and NPs that we work with, I think, are the best that I have worked with. The ICU that takes care of our post-op patients, the floor that takes care of our post-op patients are all great. Our physical therapists, occupational therapists deserve a lot of credit for their success. And then in the outpatient, they get great clinic care, and then cardiac rehab around the city. You know, it really takes a tremendous team effort to get people like Sam successfully through this journey. It's not just one person, and it's been amazing to be a part of that here at KU.
Well, we're glad that you're here with us at the health system. How does it feel to do the morning medical update for the first time?
I don't know. I'll let y'all tell me afterwards.
Well, we think you did great. And you know what happens when you do great? That means we ask you to come back again.
Okay.
So, too bad.
Fair.
We'll see you again. And Dr. Hawkinson, final thoughts.
Yeah, I think, you know, Sam's advice was the best. You know, listen to your doctors, listen to your medical teams. He talked about blood pressure monitoring, you know, doing those types of things, doing also those preventive measures, being up to date on your vaccines, I think is all important on an everyday basis, and it does add up in the future as you do those things.
All right, well, it is Thursday, and that means a brand new episode of All Things Heart is coming up at 10 a.m. Alexis, what you got?
Well, first of all, Dr. Zorn did great this morning, and we're definitely having him back.
Right?
Telling him right now, home run. This morning on All Things Heart, Jess, we all know how jarring the sound of our morning alarm clock is, right? It's always unpleasant when it wakes you out of a deep sleep. Coming up, though, we have the story of a high school junior who was having the most frightening reaction every time his alarm clock went off.
I couldn't see, like it was all black, and I didn't know what was going on. I was just kind of throwing myself around.
He was thrashing around. Talk about scary. Just as scary for his mom to witness. Coming up at 10 a.m., you're going to meet the patient and the doctors who not only treated him, but were able to diagnose him. And that diagnosis saved more than one life in his immediate family. It is remarkable. It's all coming up at 10 a.m. That's when we'll see you on All Things Heart.
Alexis, we will be watching. Thank you. And before we go, check out the impromptu parade here at the University of Kansas Cancer Center.
World champion.
We can't say that enough. We are the champions. A group of loud and very proud health system employees spread their chief spirit yesterday, slapping high fives with coworkers and patients. A huge shout out to Gloria Solis, the Senior Director of Nursing for the Cancer Center, for putting together something uplifting for patients, staff, and families who couldn't go to that real downtown parade. So we know they had a great time. Fantastic. And speaking of the real parade, we'll leave you today with some of the sights and sounds from downtown Kansas City yesterday, including our health system doctors riding up on top of those double-decker buses.
Chief Scare, everybody having a good time.
Spending time with my family is the best part of this parade.
Seeing the people. I love seeing my players. I love my Chiefs.
Well, it don't bother me. Hey, last year was colder, so this ain't nothing. I'm here every time they're going to win the Super Bowl, so I'll be here again next year, too, 2024. All the way, Chiefs, baby.
I thought it was one of the best games I've ever seen in Super Bowl, and I've been watching since 1986.
We're champions. We're champions, man. Chief Kingdom.
Coming up tomorrow on the Morning Medical Update. People with Down syndrome used to die young, but we've come a long way in a short time. I'm Jessica Lovell on the next Morning Medical Update. Modern medicine is creating longer, healthier lives. Hear what it means directly from an adult living with Down syndrome.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.